What was the question specifically of increasing?
To roll back the millage that was increased 20-some%. It's gone up 20% because of the crisis. So going forward, can we get that back to where it was a year ago?
From the small amount of time that I have been on the board, I would think that in the initial year, the next few years, the budget will be close. It's being looked at very closely, and certainly in my position in the role as a director would be to monitor every expenditure and compare that to the budget that was prepared for this fiscal year.
I believe that everyone on the board, no matter which of us is elected, is going to want to say, let's serve the community the best. And serving the community the best is going to be reducing the tax load on our taxpayer. Unfortunately, we're seeing a reduced amount of taxes coming in the government coffers, and we're seeing reduced grants and appropriations of that type. So the prospect of actually doing it is slim. The dream is very real. I wish we could do it. I'd like to be a part of that. It's going to be very, very difficult this year.
I was on the school board for several years, and the same question always comes up. You know, any taxing entity, the question always comes up. And, you know, like Tim was saying a while ago, you know, so much of what we want to do and need to do is just totally out of our hands, you know. I think if you really look at how this new hospital renovation was done with the amount of money, and you know the fiscal reasoning and how that was handled, I think you'd be very proud of how this administration handled this, and you know that we got that. But every entity is going to run up against something, again, you have no control over. You have no control over. I don't know anybody on any board I've ever been on that wants to ever raise a tax. You know, and every board I've been on, I think I've been blessed with very fiscally conservative people on boards, looks for every way possible, you know, to not do that. But if it has to be done, to make it as painless as possible.
I think it was extremely unfortunate, all of the things that happened at one time that, as Mr. Kelty has said, it resulted in the shortfall that resulted in the tax increase. I don't know all of the current board members well. I know some of them well, and everyone I know was very distressed at the situation that they found themselves in. Would we as a board, or would I as a board member, be able to roll that back? I certainly would hope so, but I think these gentlemen are probably accurate that the chances of that may be fairly slim. Although I think it would be incumbent on me as a board member to help the other board members in the administration look for other ways of raising revenue other than going to the taxpayers. And I'm certainly not the expert. I've observed a couple of board meetings, but just thinking about, do we have people or resources that we could use in other ways that could raise money? One of the beauties of the electronic record system is it provides a reminder to people and to physicians that it's time for preventative health care, and all of those mammograms and colonoscopies and all of that do generate revenue. So there are other ways that if we scheduled follow-up and make sure that it happened appropriately, and some of the other suggestions that were made, I think maybe long-term we could look at raising revenue in another way. I'm not on the board, so I can't make that recommendation. I wasn't privy to that. So, and I was one of those people who did not attend the open hearings. I shouldn't admit that, but I think the lesson is we all need to be a lot more involved, or at least I do.
Donnie's probably going to tell me to keep my mouth shut here in a minute, but let me give you an example. One of the things that happened about 5 to 6 years ago is the fact that what we always did back those years ago was in our insurance program, and we tried to trade local if we possibly could. We kind of spread everything out around all the insurance agents in town. Well, we got to looking at our insurance program, and we discovered that we had some holes in it. So what we did, we asked a consultant to come in, review everything that we had in our insurance portfolio, and to suggest to us what we needed to do. Okay? He did that, and we put it all out for bids. Everybody, local, anywhere else, had the opportunity to bid on it. Well, sure enough, somebody out of town ended up getting it because they had the low bid. Okay. We took more heat than you can think of from every insurance agent in town. A lot of them are my good friends and your good friends, and I understood their situation. But because we did that one thing, it saved you as taxpayers' dollars $7 million this year, because we had a little clause in there for errors and omissions and for things that was above and beyond our control. And when a valve in the new facility broke loose and flooded the second and first floors, it put us in a whole completely different situation. But what happened was our insurance company has paid all of those. Well, there's a certain amount they have not paid because there were some things that we had to go ahead and do. But approximately, I would say 95% of that $7 million has been paid by the insurance company and not by this taxing authority.
Could this is going to be a two-part question, I guess. And could you repeat your names again? Because I don't think I caught everybody's name. But it's been mentioned that there's a way to increase revenue by attracting physicians that are revenue producers. And so I'd like to hear from each of you how you would attract physicians, because apparently that's a challenge. And then secondly, I guess there's a $500,000 shortfall. And should there have to be made cuts, I'd just like to know specifically what you think should be cut.
I'm Bill Dietz. The question about increasing revenue with physicians, I think the hospital right now has about 5 different recruiting companies that we work with on physicians that we try to get here. Right now we're working on a urologist. We got a vascular surgeon. What else, Tim? Help me on that. Yeah, right, and an orthopedic surgeon too. So really, what you do, you look around and find and see what you're missing, okay? And like she said, that's the way you get more revenue. You provide more service, okay? We have a little problem with getting primary care people out here, and the reason is because there are relatively few compared to other specialties that are coming out. And 80% of them all have jobs before they can get through their residency. They're hired by all these Kaiser Permanente, these big groups as primary care. So that's a real problem for us. So if we can get the physicians that will draw in business and do make revenue for the hospital, that's the surgical specialties, particularly urology and orthopedics, are the two we're aiming at now. So that's what you do. I think but you want to have balance in your community. You want to provide all the services that are most commonly needed, so they don't have to leave Hopkins County to get it.
I'm sorry, I'm Dr. Larry Lanham, and what we need to do is to help attract these people, and we need to be showing them what a great quality life they can have. And Hopkins County, I'm here to attest, can certainly do that. We've got the lakes, the people, the churches. It's all here. The other thing we've got are high-quality staff at the hospital, and that's very important to any practitioner to have other good quality people to interface with and to work with. So those combination, I think we can lure them. The hospital is actively working right now to bring these people in. As has been said, there are 5 recruiting agencies working on that right now.
I'm Joseph Crouch. And to answer your question, the doctors that have come into town since I have been on the board come from all over the nation. And as a director, I have been able to sit down at a meal with these physicians to get to know them, to offer to show them around the area, to discuss our community, those are the kind of things that a director, I feel like, can help management in recruitments. Yes, that's my answer.
I'm Tim Kelty. Once again, the biggest problem that we have in recruiting doctors is competition. Because as Bill said, the specialties that's out there that brings a lot of the dollars in, everybody else is trying to secure as well. And we find in many cases, it's not only the fact you have to convince the doctor of what a good deal this is here in Hopkins County, you also have to convince his spouse. And in many, many cases, we've not been able to secure some physicians and some of these specialists because of that one particular thing, because we're not a metropolitan city. Now, there's a lot of people that's out there looking for what we've got. And I would say this about our doctors in relationship to our increase in the opportunity that we have for these specialists. I would say that we're probably, in the last year, I would say we're up nearly 75% as far as opportunities that we have to recruit some of these doctors that we did not have in the past. And one of the things that's said to us in many, many cases, that the only reason that they came to see us was because they knew we had a brand spanking new, for all practical purposes, facility and our 3-story bed tower and our new ER. So even though that's not all of it, they know and they believe that this is a community whereby that does care for their patients, and also they give them the opportunity to be better servants.
I'm Suzanne Thomas Bankston, and I agree with what all of they said. I think, though, there were a couple of points that were touched on that we might need to explore a little bit more. I think it's wonderful that we are recruiting the specialties, and as I said, my family's used them, and there are many areas that you don't have to go to Tyler or Dallas or someplace else, that you can have the work done here. I think it's incumbent on the board members to make sure, and this is an overlay with the community, to make sure that those resources are available. We're recruiting people, or the board is, that are highly specialized, and they use highly specialized equipment. I visit frequently where Dr. Dietz is in the wound care center, and some of the things that they are doing there is absolutely phenomenal. Well, we have got to work with the local schools and the community colleges and the A&M Commerce and UT Tyler and all of the other North Texas about training and making sure we have support staff here that's available for the physician should he or she, want to look here at what we have available. I think that is an area we haven't talked about, but it's how the hospital district fits in as a part of the community, and the hospital supports the community, but we are also a major employer. So you can't have Sulphur Springs in Hopkins County without the hospital. It's a major player in many different ways. And working with the community to provide those sources that the spouses, whether it be a he or a she, are looking for. So. The last part of your question, I'd forgotten about that. Since I'm not on the board and not privy, I don't really have any specific kinds of answers. I think it's incumbent to look at all of the services and look at how things can be combined or consolidated. What can we use telemedicine for? How can we not actually harm people as far as their salary? I don't think it's always the right thing to do, to cut the low man on the totem pole. Absolutely not.